The Washington Post has obtained an internal CDC document that says the Delta variant of COVID-19 not only spreads much more easily than other variants, but may cause more severe illness as well. The Post writes tonight, quote, the document is an internal Centers for Disease Control and Prevention slide presentation shared within the CDC. The document strikes an urgent note, revealing that the agency knows it must revamp its public messaging to emphasize vaccination as the best defense against a variant so contagious that it acts almost like a different novel virus, leaping from target to target more swiftly than Ebola or the common cold. It cites a combination of recently obtained, still unpublished data from outbreak investigations and outside studies showing that vaccinated individuals infected with Delta may be able to transmit the virus as easily as those who are unvaccinated, end quote. The Post reports that this still unpublished data was behind the CDC's decision to change mask guidance this week, calling for masking indoors in certain public settings, even for vaccinated people. But the CDC still has not made this data public. Here's one slide from the CDC presentation published by the Post tonight. It summarizes the findings on the Delta variant this way, quote, Delta is different from previous strains, highly contagious, likely more severe. Breakthrough infections may be as transmissible as unvaccinated cases. Another slide says, quote, universal masking is essential to reduce transmission of the Delta variant. And on a slide titled Next Steps for CDC, it says, quote, acknowledge the war has changed. Joining us now is one of the reporters who broke this story tonight, Washington Post health policy reporter Yasmeen Abutaleb. Yasmeen, thank you for joining us tonight and for your reporting. I want to be clear. You have reported this out. You've got images of these slides. The CDC has still not said this. They've not made this public.
They have not. What we have from our reporting is that they're expected to release the data that prompted this decision tomorrow. Even in these slides, they mention data, they cite studies, they cite their own investigations, but the actual methodology, the data, the sample size is not in there yet. The expectation is that they will publish that tomorrow. We
spoke to the head of the CDC here on Tuesday night, where they had talked about this new mask guidance, which has, confused some people because they feel like it's a backtrack or a reversal. The CDC says it's an update, but that's the masking part of things, that vaccinated people should wear masks in some circumstances indoors if they are in a high transmission area. What are they doing about the vaccine problem? Because that's still stuck where it is.
That's a lot of what's addressed in this document. One of the first slides in there says that there's public skepticism, not a lot of public trust in the vaccines. They recognize that they have a messaging challenge, that in the fact that there are rising breakthrough infections in vaccinated people because Delta is so transmissible and it behaves differently than earlier strains. But they also still need to emphasize to people that vaccines are the most effective tool that we have. They are still highly protective. You are at far, far greater risk of death or severe illness with the vaccines, but they have to simultaneously acknowledge that the individual risk to vaccinated people varies depending on a number of factors, including age and whether they have compromised immune systems.
There's a lot of data in the CDC report and in the report that you and your colleagues published tonight. One of the standouts here is that Delta variant breakthrough cases, people who have these breakthrough cases, may be as transmissible. The virus may be as transmissible as unvaccinated cases. That seems to be new information.
It is, and that was the key piece of information that supported their decision to recommend that vaccinated people wear masks indoors and in certain settings in areas with substantial transmission. This is not how the previous variants behaved, but what they found is that vaccinated people and unvaccinated people who get infected with Delta have the same viral loads, and they've also found that that means that they can spread the virus just as efficiently as an unvaccinated person. They're still far less likely to get seriously sick or to die or end up in the hospital, but the transmission piece of it is what's really concerning and prompted that that change in the mask guidance.
Now, in fairness, Yasmeen, you know more about this than I do. So when I saw that it could be as transmissible as Ebola or the common cold, what's that supposed to mean? Does that mean it's a great factor of transmissibility greater than they or we thought the Delta variant had?
It is. It's highly transmissible. They say it's just as infectious as chickenpox. It's more than twice as transmissible as previous strains of the virus. So that's one of the really concerning things. And I think this document really shows that the CDC sees that we're at a pivot point in the response. Things were getting better for a couple of months. We've seen cases surge over the last few weeks. I think fortunately hospitalizations and deaths are still lower than they were with the summer surge last year because so many people are vaccinated. But given the way Delta behaves, the fact that vaccinated people can still contract it and spread it, this is a new worrying phase of the pandemic. And I think we'll see that they stress in there, they actually call for universal masking, which their guidance stops short of. They say just in certain circumstances. But they also say, we need to look at other non-pharmaceutical interventions. They don't call for restricting gatherings or anything like that, but, say that it maybe should be evaluated depending on how things progress.
We know last year at this time, there was a lot of fighting and disarray at the CDC. What's the level of agreement on these policies and the way to move forward on them right now within the CDC?
It's hard to tell just from this document, the level of agreement. There is a note in there saying that it's the view of the authors and not the agency's official position. But I think you can see the agency's clearly taking this very seriously. It did support their decision earlier this week to reinstate some of those mask recommendations. And it seems like across the administration, there is a pretty joint recognition that this is a new point of the pandemic. We need to buckle up again. There was some celebration over the summer, but this is a new point. And I think you saw the president also addressed that when he was answering reporters today.